Okay, let's dive in. We've got some material here looking at a really common skin condition, atopic dermatitis.
Right, which most people probably just call eczema.
Exactly. So our mission basically is to unpack what it is, what it feels like, looks like, maybe why it happens according to these sources, and importantly, what can be done.
Sounds good.
The sources start with a helpful idea. Think of your skin as a protective wall.
Yeah, keeping the good stuff in, like moisture, and the bad stuff out, irritants, and so on. This condition, atopic dermatitis, is essentially about that wall being a bit, well, weaker.
A weaker wall. Okay, so medically, the sources define it as.
They call it a chronic, meaning long-lasting inflammatory skin condition. And yeah, it's the most common type of eczema.
And that word atopic is important, right? The sources mentioned that.
Atopic points to the immune system. It suggests a tendency towards allergic-type reactions.
Ah, so that's the link.
Exactly. That's why, as the sources note, people with it often have other atopic things like, asthma or hay fever. It's sort of a pattern in the immune response.
Got it. So it's tied into the bigger immune picture, not just skin deep.
Hmm.
And back to the wall idea. If it's weaker, the sources say skin loses moisture easily.
Precisely. And it becomes much more sensitive to things it comes into contact with. Irritants, allergens, stuff like that.
Which is probably why it's so common, especially in children.
That's what the sources suggest, yeah. Very common in childhood, although adults definitely get it too. And really important point they make, it is absolutely not contagious.
Okay, good. Definitely need to stress that. You can't catch it.
Yep.
So this weaker wall, what does it actually feel like for someone? And what are we seeing on the skin? What's the #1 symptom mentioned?
Itch. Across the board, the sources emphasize intense itching. Like really severe, can mess with your sleep kind of itch.
Wow.
And sometimes that itch actually kicks in before any visible rash appears.
The itch comes first. That really tells you something.
It does. And then visually, what you'll typically see are patches of skin that are very dry, maybe rough, often inflamed so they look red. And the sources are good to point out on darker skin tones that inflammation might show up more as brown, purple, or sort of grayish patches.
That's a crucial detail.
Hmm.
And what about from scratching? Because if it's that itchy.
Right, exactly. Scratching makes it worse. The sources explain this can lead to the skin getting scaly or thickened. Sometimes you see little bumps that might weep or leak fluid and then crust over.
And where does it usually show up? Does that change with age, according to the material?
It often does, yeah. In babies, the sources say look for it on the face, the scalp, maybe the outside of elbows and knees.
Okay.
But in older kids and adults, it's more common in the creases, like inside the elbows, behind the knees, also neck, hands, feet. Those locations can be a clue.
Okay, so we know what it is, what it looks and feels like. Now the big question, why? Do the sources give a definitive cause?
They're clear that the exact cause isn't fully pinned down. It's generally seen as a mix of factors.
Like what?
Well, genetics is a big one. It often runs in families. So if you have family members with eczema or asthma or hay fever, those atopic conditions we mentioned, your risk is higher.
That makes sense, linking back to the atopic thing. What
Right.
else?
Then there are those immune system issues. Again, the idea that the immune system sort of overreacts, causing inflammation in the skin.
Right.
And then tying back to your wall analogy, there are problems with the skin barrier itself. The sources say this weakened barrier lets moisture out and makes the skin super sensitive to environmental triggers.
Triggers like, did they give examples?
Yeah, common things. Pollen, dust mites, some soaps or detergents can do it. Even certain foods for some people. It's this interaction, Genetics, immune system, environment, all affecting that skin barrier.
Okay, so it's complicated, which leads to the question everyone asks with chronic stuff. Is there a cure? What do the sources say?
You're very direct on this. Currently, no. There isn't a cure for atopic dermatitis.
No cure.
Yeah.
That's dead.
It is tough to hear. But the sources immediately shift focus to management. While you can't cure it right now, there are lots of effective ways to manage the symptoms, to really improve how the skin feels and looks.
Okay, management. What kind of strategies are we talking about based on the material?
Things like using specific types of moisturizers, emollients really regularly to help repair that barrier function.
Right, keeping the wall strong.
Exactly. Also, using topical steroid creams when needed to calm down the inflammation during flare-ups. And a really key part is identifying and trying to avoid your personal triggers.
Finding out what sets it off for you.
Yes. What makes your eczema flare up?
So it sounds like it's less about eliminating it and more about learning to live with it, keeping it under control.
That's the message from the sources, pretty much. It's chronic, yes, but with the right care, avoiding triggers, using treatments when needed, people can live comfortable, normal lives.
Okay, let's sum up this deep dive then. Atopic dermatitis, or eczema.
Mm.
It's common, definitely not contagious. It involves a skin barrier that's not quite doing its job, linked to our genes and immune system. The main feature is that intense itch, plus the dry, inflamed, sometimes scratched up skin patches. And crucially, while the sources say there's no cure yet,
There's a strong focus on management through good skincare and avoiding those personal triggers.
right, which leaves us with a thought maybe. Given that there's no simple cure, but management relies on navigating this complex interplay between our internal biology, genetics, immunity, and our external environment, what does that tell us about how we approach chronic conditions more broadly? That ongoing relationship between our bodies and the world around us.
Yeah, it really highlights that constant negotiation, doesn't it? Something to think about.